Multifetal pregnancy. Okay, let's talk about twinses. So what are twinses? Twinses are the offsprings produced by the same pregnancy. The incidence of twins is highest in Nigeria, that is 1 in 20, and it is lowest in Japan and in 1 in 80 in India. That means out of 80 pregnancies there could be chance of one twin pregnancy, and it increases with the use of drugs like clomiphene citrate, gonadotropins, and procedures like IVF. And the frequency of the multifetal pregnancy is twin 1 in 80 pregnancies, and the triplets 1 in 80 square, and quadruplets 1 in 80 cube, and so on. And this frequency is given by the name of, which is known as Helin's rule. Twinses can be either monozygotic or dizygotic. Monozygotic are the identical twins. That means they develop from one zygote that splits and forms two embryos. And dizygotic develop from two separate eggs that are fertilized by two separate sperms. Zygosity is used to describe the genetic similarity or dissimilarity of twinses, refer to the type of conception. So just now I said monozygotic are the identical twins. That means they develop from the one zygote. Okay, that develops from one zygote that splits and forms embryos. Monozygotic twins could be theoretically arise by a splitting of two-cell embryo. Okay, I'm talking about splitting. Okay, so before knowing the splitting, I would like to explain the process of fertilization in the brief, and then I will be back to this slide again. So let's have a look of process of fertilization and implantation in brief. So here you are. Process of fertilization begins with the fusion of sperm with an ovum pronucleus. Okay, and fertilization occurs in the fallopian tube. Sperm penetrates the corona radiata. You can see in this image, sperm penetrates the corona radiata of the ovum, then zona pellucida, and enters the oocyte membrane and fuses to oocyte and forms zygote. Okay, and zygote stays in the fallopian tube for 3 days after fertilization, and then undergoes cleavage, mitotic cell divisions. 2 cell stage 36 hours. At 48 hours it reaches the 4 cell stage, and around approx 60 hours it is 8 cell stages, and around 72 hours it is 16 to 32 cell stages. Okay, this stage is known as morula. And after 3 days of the fertilization, conception consists of 16 to 32 blastomeres and becomes morula, and enters the uterine cavity on approx 4 days after fertilization, that is the 18th day of the cycle. As the morula enters the uterine cavity, fluid enters it and morula gets converted to blastocyst. Okay, and the cells of blastocyst differentiates into embryoblast, that is inner cell mass, and trophoblast, that is outer cell mass. ICM, that is known as embryoblast, right? And then trophoblast, that is outer cell mass, trophoblast, that is outer shell mass. So ICM forms the embryo or fetus. Okay, and this trophoblast will form the placenta and the fetal membrane. Okay, and then this blastocyst penetrates the uterine mucosa and get implanted in the endometrium, and the implantation begins in 6 to 7 days after fertilization, that is 20 to 21 day of the regular menstrual cycle. So most common site of implantation is posterior surface of the upper uterine segment, 2/3, and the anterior, and 1/3 chance of the implantation is the anterior surface of the upper uterine segment. So that was the process of the fertilization that I talked about just now. So let's see about the splitting. Okay, so if a splitting occurs within 1 to 3 days, okay, so there would be chance of formation of two placenta and two amniotic cavity. Okay, you can see here two placenta, that is dichorionic, and you can see one placenta, second placenta, okay, and two amniotic cavity. Okay, two amniotic cavity. So if the cleavage occurs in the morula by the day 1 to 3, then it will form two placenta and two amniotic cavity, and this kind of pregnancy will known as dichorionic and diamniotic. Dichorionic and diamniotic twins. Okay, and if the cleavage occurs on the day around 4 to 6, okay, then it will form single placenta. It will form single placenta, that is monochorionic, and two amniotic sac, that is dimonochorionic, single placenta and two amniotic cavity, that is known as diamniotic. So this kind of twins will known as monochorionic diamniotic. And if the cleavage occurs around 18 to 13 days, okay, it will form single placenta and single amniotic cavity. So this kind of twins would be known as monochorionic, single placenta and single amniotic cavity, monoamniotic. And if the cleavage occurs around day 13 to 15, there will be single placenta, single amniotic cavity, but what will happen here? The part of the fetus would be joined, and this is known as conjoined twins. Later I will discuss in detail about the conjoined twins. So the main point about here I was discussing was splitting. Okay, so if the splitting occurs 1 to 3 days, it will form dichorionic, diamniotic. If it occurs around 4 to 6 days, it will form monochorionic, diamniotic. If it's 8 to 13 days, it will form monochorionic, monoamniotic. And 13 to 15 days, it will form conjoined twins. Okay. So let's back to the previous slide. So monozygotic twins could be theoretically arising by the splitting of two cell embryo. It is commonly accepted that most arise by the subdivision of the inner cell mass in a blastocyst, or possibly even the splitting of the epithelial epiblast a few days later. In monozygotic twins, the number of chorion and amnion depend at the time which differentiation occurs. Just now I discussed, if division of the single fertilized ovum occurs in less than 3 days, right? So it will form dichorionic, diamniotic, means two placenta, two amniotic cavity, and that is known as dichorionic, diamniotic. And if it occurs in around 4 to 8 days, it will form monochorionic, diamniotic, that means single placenta and two amniotic cavities. And if it occurs after 8 days, monochorionic, monoamniotic, single placenta, single amniotic cavity. And if it is after 14 days, it will be conjoined twins. All monochorionic pregnancies are monozygotic, right? All monochorionic pregnancies are monozygotic. You can see here, okay, and dichorionic. If it is dichorionic, then you can think like this, like monozygotic, could be monozygotic or dizygotic. And if the twins of the different sexes, they are always dizygotic, always dizygotic. But if the sex of the baby is same, it could be monozygotic or dizygotic. So let's see. Okay, now dizygotic. Dizygotic, there is nothing to do with the time of the splitting here, because dizygotic twins develop from two separate eggs. Okay, that means dizygotic develops from two separate eggs that are fertilized by two separate sperms. Okay, so there could be two chances here. First is superfecundation, that is the fertilization of two ova, fertilization of two different ova released in the same menstrual cycle by separate acts of coitus within a short period of time, which can lead to twin babies from two separate biological fathers. Okay, so here you can see two different ova released in the same menstrual cycle, and that will be fertilized by the two separate biological sperm of the two separate biological fathers. So it could be homopaternal or heteropaternal. So if the two separate ova are fertilized by the sperm of the same father, that is known as homopaternal and leads to fraternal twins. But if what happens if occurs through either separate occurrences of the sexual intercourse or through artificial insemination, so this is known as heteropaternal or superfecundation. So in this process, superfecundation, what is happening here? Superfecundation overall, there is a fertilization of two different ova released in the same menstrual cycle. Okay, in the same menstrual cycle by separate acts of the coitus within a short period of time, right? And if the fertilization of the two separate ova from the same father, that is known as homopaternal superfecundation. And if it occurs through separate occurrences of the sexual intercourse or through the artificial insemination, so it will form heteropaternal superfecundation. Superfetation. Now let's look at the superfetation. Superfetation. This is superfetation. Here, the fertilization of the two ova released in different menstrual cycle, while another embryo of the fetus is already present in the uterus. Okay, so this is the process where the fertilization of two ova released in different menstrual cycles while another embryo or fetus is already present in the uterus, theoretically possible until the deciduous space is obliterated by 12 weeks of pregnancy. Okay, try to differentiate these two terms, superfecundation and superfetation. In superfecundation, you can see two different ovaries released in the same menstrual cycle, but in superfetation, you can see ova released in the different menstrual cycle. Okay, let's solve a question. So, question is placenta of the twins can be. Okay, let's read the options and try to answer. Dichorionic monoamniotic in dizygotic twins, dichorionic diamniotic in monozygotic twins, dichorionic and monoamniotic in monozygotic twins, monochorionic and monoamniotic in dizygotic twins. So what's your answer? Okay, let's discuss the answer. So I would like to rule out these two options first. Dichorionic monoamniotic in dizygotic twins and monochorionic monoamniotic in dizygotic twins. As I have clearly discussed, dizygotic are always have dichorionic and diamniotic, right? Dizygotic twins. Dizygotic twins are always dichorionic diamniotic, right? So cross and cross. Okay, now let's read these two options. Dichorionic diamniotic in monozygotic twins. Okay, and dichorionic and monoamniotic in monozygotic twins. Okay, so I've written something here. Amnion develops after chorion. That means it can never be a twin with dichorionic but monoamniotic, right? So this means this option, look at this, it's saying dichorionic monoamniotic in monozygotic twins, right? So this is also wrong. And the last option remain here is dichorionic diamniotic in monozygotic twins. We have already discussed this, and this is the correct answer. Okay, this is the correct answer. Dichorionic diamniotic in monozygotic twins. Okay, always keep in mind that amnion develops after chorion. So dichorionicity implies diamniosity. It can never be a twin with dichorionic but monoamniotic. Okay, let's move to next. Okay, let's summarize. Let's try to differentiate between monozygotic and dizygotic twin cases. Okay, so monozygotic twins, they are developed from the single egg which was fertilized by a single sperm cell. But on the other side, dizygotic twins, they develop from the two eggs fertilized by the two different sperm cells. And monozygotic twins are they do have the identical chromosome, but dizygotic twins, they do not have the identical chromosomes. Okay, and monozygotic twins have almost identical genetic profile. Okay, because they do have the identical genetic profile, but the dizygotic twins, they are completely different genetic profile. And monozygotic twins always of the same sex. but dizygotic twins could be of the same or of the opposite sex. Monozygotic twins may have the same physical and mental characteristics, but dizygotic twins may look alike or different, may behave similarly or differently. And monozygotic twins are also called as identical twins. But the dizygotic twins, they are called as fraternal twins. And monozygotic twins, they are less common, 30%, and dizygotic twins are the more common, that is 70%. They do have same genetic features, same DNA imprints, their skin grafting is accepted, different, but there will be different fingerprinting. Don't get confused with genetic feature and same DNA imprint. This DNA imprint and this fingerprint, they are different things. Don't get confused. Okay, DNA imprint will be same, but there will be different fingerprinting in monozygotic twins. But in dizygotic twins, there is different genetic features, different fingerprints, their skin grafts are rejected, everything different. And if we talk about the number of chorion and amnion, it will depend on the time of the differentiation. But here, no, here always have 2 chorion and 2 amnion in dizygotic twins. That is dichorionic and diamniotic. Keep in mind, this do not depend on the time of differentiation. It is always 2 chorion, 2 amnion, dizygotic, diamniotic in dizygotic twins. And the number of, and then in monozygotic twins, incidence remain constant, that is 1 out of 250 deliveries throughout the world. Okay, now let us talk about the incidence of the twin pregnancies. It increases with the maternal age, maternal family history of the twinning, increased parity, and ovulation induction drugs like clomiphene citrate, gonadotropins. So this was all about the summary of the monozygotic twins and dizygotic twins. Now let's look at the radiographic features. Radiographic features. Radiographic features. Okay, we will see the we will do ultrasound assessment of the multifetal pregnancies, and what we will see in the ultrasound. So, if the placenta is double, if there is double placenta, and the membrane thickness is more than 2 mm, if the membrane thickness is more than 2 mm, and the number of layers in the membrane is 4, that means 2 amnion and 2 chorion. And if we can see a twin peak sign or lambda sign after 10 weeks. Okay, so you can see in this ultrasound image, you can see something like this. Okay, right. So this sign is known as twin peak sign, or it looks like mathematical lambda, right? So this is also known as lambda sign, and this can be seen after 10 weeks. So you can see here, due to the thickening of this membrane, this sign is visible, right? So due to chorionic tissue in between the 2 layers of the intertwin membrane at placental origin. Okay, so if we can find these signs, double placenta, membrane thickness more than 2 mm, and twin peak sign, so this shows it is dichorionic. And if the placenta is single, membrane thickness less than 2 mm, and number of layers of the membrane because of the is 2 because of 2 amnion, and here you can see this image. Okay, this, it's like T, right? So T sign. Okay, because of no chorion tissue and intertwined membrane. Okay, so if we find these signs, single placenta, membrane thickness less than 2 mm, and T sign, so this shows monochorionic. And let's move next. Now we have done the radiological assessment, and now we should look for the management of the labor of the twins. So management, first we will look according to the time of the delivery. Okay, so first, if it's monochorionic and monoamniotic, okay, monochorionic, monoamniotic, okay, so if the time is 32 to 34 weeks, okay, we do C-section, cesarean section at 32 to 34 weeks after giving corticosteroid. And if it is monochorionic diamniotic, then we do elective delivery at 36 to 37 weeks. Okay, and if it is dichorionic twins, then also elective delivery 37 to 38 weeks. And if it is triplet pregnancy, then also elective C-section at 35 weeks after giving corticosteroids. So you can see, if it is monochorionic pregnancy, monochorionic monoamniotic, then we will do C-section at 32 to 34 weeks after giving corticosteroids. Okay, and if it is monochorionic diamniotic and dichorionic twins, then we will do elective delivery. And triplet pregnancy, then elective C-section at 35 weeks after giving corticosteroid. If it is monochorionic, monoamniotic, right, that means monochorionic, single placenta and single amniotic cavity. Okay, single placenta and single amniotic cavity, then we will do C-section. Okay, if it is monochorionic, means if there is single placenta but 2 amniotic cavities, then we can do elective delivery. If it is dichorionic, then dichorionic also we will do elective delivery. So this is the case here. You can see monochorionic, monoamniotic, right? Single placenta, single amniotic cavity, we will do C-section. And in triplet pregnancy, we do C-section. Okay, here you can see we are giving corticosteroid. This is for the fetal lung maturity. Okay. Now, if the first twin is cephalic, and if the first twin is cephalic, then we do vaginal delivery. Okay, and if the first twin is breech or transverse lie, then we do C-section. But what if the first and second twin both cephalic? Then it is good, we do just vaginal delivery. Okay, and if the first twin is cephalic, we do vaginal delivery, right? And second twin, if the first twin is cephalic and the second twin is transverse lie, then what we will do? Then we do internal podalic version. Internal podalic version. Okay, internal podalic version. I will discuss this in brief. Internal podalic version. It's a procedure that is done under GA in OT to make it breech and do its breech extraction. And now if the first twin is breech or transverse, then keep in mind, always do cesarean section. Always go for C-section. If the first twin is breech or transverse, then always go for C-section. Okay. So this is the process. Here you can see it's internal internal podalic version. Internal podalic version, right? It's a procedure. It's a procedure of turning the lie of the fetus by inserting hand into uterine cavity, holding the foot baby and making bridge. Making bridge followed by bridge extraction. And internal podalic version it's OT procedure. It's a OT procedure done under GA, general anesthesia, and the risk of there is the risk of uterine rupture. So internal podalic version is a procedure of turning the lie of the fetus by inserting hand into the uterine cavity, holding the foot of the baby and making bridge, followed by bridge extraction. It's a OT procedure done under general anesthesia, and there will be the risk of uterine rupture. Okay, now we will see the indications of cesarean in the twins. So what are the indications of cesarean section in the twins? Like when we need to do cesarean, when we need to do C-section in the twins. So as I have discussed that if the first baby is not cephalic, that means first twin non-vortex, you can also say like this, then we do cesarean section. And if there is a history of previous cesarean section, then also we do cesarean section in the next pregnancy. And twin with the bad prognosis, that is conjoined twins, okay, and monochorionic, monoamniotic twins, okay, we do cesarean section. Why? Because there is a high risk of cord prolapse or entanglement, and that could lead to the fetal death. That's why we do cesarean section in the case of monochorionic, monoamniotic, and twin transfusion syndrome. We do cesarean section. I will discuss about this later in later slides. And this is seen, twin transfusion syndrome is seen in monochorionic twins, and discordant twin with weight of a smaller twin less than 1500 gram, then we do cesarean section. And if there is severe IUGR of one or both twins, then we do cesarean section. And the OBS factors like contracted pelvis, placenta previa, severe preeclampsia, then also we do cesarean section. Okay, and about the malpresentation, if there is transverse lie, the bro presentation, face, mento-posterior presentation, breech footling, knee presentation, if the large second twin more than 3.5 kilograms, okay, and prompt closure of the cervix after delivery, then in these cases we do cesarean section. Okay, these all are malpresentation. So in the case of malpresentation, we do cesarean section. Okay, and when we do in emergency C-section, in which case we need to do emergency C-section. So if there is fetal distress, then we do emergency C-section. And if the cord is prolapsed in second twin, then we need to do immediate C-section. And if the labor is there is no progress of the labor and collision of both the twins, so in these cases, keep in mind we need to do emergency C-section. So that's all for today.